Are you pregnant and is already nearing your due date? When do you go to the hospital? Getting pregnant during the pandemic is already a stressor to most of us, much more giving birth. So if you are worried, anxious, and clueless on what to expect about labor and delivery, then this video is for you. Hi, I am Dr. Shi Armero, your friendly OBGYN and lifestyle medicine specialist, and you are watching Doc Shi TV, your way of life. Welcome back to my channel, loves. Thank you for always supporting by subscribing in my channel. And if you are not a supporter yet, please click the subscribe button below and turn on the notification bell for you to be notified when I upload new videos. A patient sent me a message in my Facebook page seeking guidance. Doctora, I am already due tomorrow. When do I go to the hospital? What should I watch out for before going to the hospital? I don't want to be admitted too early because I don't want to stay there very long. Are you a first-time mom? Or everything about the pandemic just erased your memories from previous deliveries? Are you a husband who wishes to assist his wife who is about to deliver? Then, watch this video because today we are going to talk about the things to watch out for before going to the hospital for labor and delivery. When to go to the hospital? My 3 important points. First point, watch for regular uterine contractions. Uterine contractions may be painful or not painful. It depends upon the pain tolerance of the patient. It's the feeling of tightening that comes and goes, and it starts in the tummy and moves to the back. Regular uterine contractions mean that these repetitions of tightening comes every 5 minutes, at least for 1 hour. Again, it's a tightening that comes every 5 minutes, at least for 1 hour. So if you were having your walking exercises and you feel that contractions come every 5 minutes, try to rest. And if contractions persist after you rested, or it becomes closer, or the interval becomes closer to every 2 to 3 minutes, then it's time to go to the hospital. Now, if after you have rested, the contractions were gone, then most likely it was a false labor. So, regular uterine contractions. Just a warning, especially among Filipinos, it is a common practice to put on liniments such as the more popular are manzanilla or lana sa bitin to alleviate these contractions, or the older people believe this will hasten labor. These liniments do not have studies on safety profile among pregnant women, and this may endanger the baby inside. And so instead of applying liniments, if regular contractions are noted, you seek immediate admission instead. Number 2, watch out for watery discharge. This is the most commonly misperceived among patients, especially that in our drama where the rupture of the bag of water is shown as if the floor was splashed with a bucket full of water, when actually a rupture of the bag of water can just be a seemingly continuous flow wetting of the underwear, as if it is like urine staining the underwear without the urge to void. Oftentimes, the appearance is clear and watery, but other times, It may be colored green or brown depending on whether the baby already pooped inside. So mothers should be watchful of this because number one, the risk of infection increases once the bag of water ruptures. And number two, the umbilical cord of the baby might go out or it might prolapse. And third, labor might progress sooner, especially among those who had prior vaginal deliveries already. This means that delivery might be imminent. So go to the hospital immediately when you notice watery vaginal discharge. What do we expect if the bag of water ruptures ahead? Number one, labor will be expedited to prevent infection to occur. Meaning when the patient reaches to the hospital, we give medications such as oxytocin to augment or to hasten labor, especially when contractions are not yet coming in regularly. Second, depending on the time of rupture, antibiotics will be given. So you will be covered with intravenous antibiotics. And third, close monitoring of the mother and the baby in case there will be signs of infection. Therefore, a watery discharge is not something we just brush off. So again, be careful with watery discharges. Number three, decreased fetal movement. Watch for decrease in fetal movements. Babies inside the tummy of mommy move vigorously after mommy eats something. And so the best time to count the baby's movement is within 2 hours after a meal. Expectant mothers should be doing this at least once a day. You just choose whether after breakfast, after lunch, or after dinner. There should be at least 10 kicks within 2 hours after eating. If you notice that the 2 hours have lapsed already and yet the kicks have not reached 10, go to the hospital. A mother's perception is a reliable and cost-effective way of finding out the condition of the baby. You will not be questioned if you go to the hospital complaining of decreased fetal movement, because a decrease in fetal movement is already an enough reason to warrant further investigation, because when you come in without fetal movements anymore, then that will be too late. Now, once again, remember the 3 things to watch out for. First, regular uterine contractions. Second, watery discharge. And third and last is decrease in fetal movement of less than 10 kicks within 2 hours from eating. If you have these 3, go to the hospital already. Now, next question, what do we bring? First, bring your doctor's orders. This is usually given to patients who are nearing delivery, usually at 37 weeks onwards. But don't worry if you do not have this, as long as you have your obstetrician or you know who your obstetrician is, the hospital will be the one to reach your obstetrician as you arrive at the emergency room. Number 2, swab test result. Yes, at this time of pandemic, a COVID RT-PCR is necessary for the medical providers to triage you. Meaning, when you have your results known, it will be easy for us to locate which labor room to put you. We have the clean labor room and delivery room for those with a known negative result. And if you have an unknown status or a positive COVID RT-PCR result, then you will be placed in the infectious labor room, delivery room complex. Now, with this too, what else are to bring? Of course, the essentials for mother and baby. Mommy will at least need clothes that are conducive for breastfeeding because, of course, we want the best milk to be given to baby, and that's breast milk. So the clothes should be conducive for breastfeeding, meaning areas nearing the neck should be open. Now, toiletries, toothbrush, soap, towel, underwears, maternity napkin or maternity pads, and slippers, comfortable slippers for mommy. And baby will at least need clothes, blanket, diapers, and the rest of whatever baby needs. The nursery staff will be happy to be guiding you on this. Now that you are all set, do not forget to request for prayers of a safe delivery from family and friends. Personally, I discourage visitors during this time. It will be better for mommy and baby to have very, very limited guests. As much as possible, those guests should have a known COVID status as well to avoid infection to our newborn baby. Prayers and well wishes will be more than enough during this time. And if you wish to send a congratulatory gift, food will be very much appreciated. Labor will not be easy for the patient, much more to the significant other waiting outside, uncertain of what is actually happening inside the labor room. If it helps you, you may request for updates from the labor room staff once in a while. I hope this video has at least answered some of your concerns, and if this has helped you, do not forget to hit like and you comment and share this to those who you think will be guided by the 3 steps or the 3 points or the 3 tips on when to go to the hospital. Once again, I am Dr. Shi Armero, your friendly OBGYN and lifestyle medicine specialist, and you are watching Doc Shi TV, your way of life. Till the next video, bye!